My name is Lee Hammontree, and I'm originally from Nashville, Tennessee, and had the opportunity to go to medical school in 1984 and completed medical school in Memphis at the University of Tennessee. And at that time I started my residency, which was a 6-year residency in urology, and completed that in 1994. During those years I had the opportunity to train under some really great urologists. In 1994, we moved to Birmingham, Alabama, and I joined Dr. Tom Moody and Dr. Andrew Daniel, and we were a 3-man practice, and our group's name was Urologist PC. During those years, I became very interested in laparoscopic urology. Laparoscopy at that time was rarely used for urologic surgery, and I was one of the first urologists in the state to start doing laparoscopic surgery at that time for bladder prolapse, pelvic prolapse, and stress urinary incontinence, and soon we started doing laparoscopic kidney surgery. And I was one of the first urologists to do what at that time was a hand-assisted laparoscopic nephrectomy. My interest in minimally invasive surgery led to an opportunity eventually to join the faculty of UAB and get to work with residents and do teaching and research. And I had the opportunity to be the chief of urology at the VA Medical Center for a few years. During those years, my interest in minimally invasive kidney surgery continued, and we started doing laparoscopic and robotic prostate surgery as well as robotic kidney surgery. In 2006, I had the opportunity to rejoin what then had become Urology Centers of Alabama, and our group has grown and grown over the years. My current interest continues to be kidney cancer, cryosurgery for both prostate cancer and kidney cancer, as well as robotic kidney surgery for cancer and kidney reconstruction. I think one of the great things that sets Urology Centers of Alabama apart from other urology practices is our emphasis on sub-specialization. We have doctors who subspecialize in prosthetics as well as prostate cancer surgery with robotics, and my subspecialty interest happens to be kidney cancer surgery. In 2006, we began offering laparoscopic cryoablation, which is the freezing process for kidney cancers, and this is available for kidney tumors that are under 4 centimeters in size. We have also been the leader in robotic surgery, and kidney cancers can also be removed with robotic procedures, and this cuts down on the incision size and improves the healing time, and has been a great way to save patients from losing their kidney, which would have happened 10 years before. I also maintain an interest in prostate cancer surgery with cryoablation, and patients often have their prostate cancer treated with the freezing process as a primary treatment, but more often we use it as a backup treatment when patients have had radiation and their prostate cancer returns. Another procedure that we do with robotic surgery is repairing kidneys that are obstructed either with kidney stones or ureteropelvic junction obstructions, which is a inborn problem with the outflow of the kidney, which becomes obstructed, and this can occur in people of all ages, from teenagers up through older adults, and we're able to do an operation robotically which repairs that obstruction. That's called a robotic UPJ repair. Here at Urology Centers, each of us typically have a very busy office practice, and some of the office procedures we do include cystoscopy, which is looking inside the bladder, which is a way of looking for diseases of the bladder, including bladder cancer or bladder stones. We also offer vasectomies in the office, and I perform a no-scalpel vasectomy, which involves just a small puncture wound in the scrotum instead of an incision, and typically I do both sides with one tiny opening in the scrotum. So vasectomies and other office urology has become a big part of my practice.